Thank you, Madam Chair and members. We're here to present AB 1876, the Fair Care for All Act, that would codify federal non-discrimination protections into state law to ensure that no individual is excluded from healthcare coverage or services based on a protected class. And with that, I have two witnesses here. Malachi Cote, Director of the Gender Health Center, and Alex Bass, Policy Associate with the Trans-Latine Coalition. And I might add that this committee heard this bill last year, carried by Senator Menjivar, and the Senate fully supported it, as did the Assembly. So I'll turn it over to my witnesses and hear for any questions.
Thank you. You have a combined of 5 minutes for your presentation.
Thank you. Good afternoon, Chair Weber Pearson and Senators. My name is Alex Bass. I'm a Los Angeles resident. I identify as transgender and non-binary, and I am the Policy Associate at the Trans-Latina Coalition. The Trans-Latina Coalition is the largest transgender-led organization in the nation, serving transgender, gender-expansive, and intersex Latina immigrants. We are a proud co-sponsor of AB 1876, and we identify this bill to be a crucial piece in protecting access to healthcare for TGI people. AB 1876 provides a definition of sex-based discrimination that would account for the various factors that make TGI people vulnerable when navigating healthcare systems. This is particularly important for TGI people who may face discrimination based on compounding factors, such as perceived gender identity, sex stereotypes, and institutional racism. I know firsthand the positive impact of accessible affirming care. I accessed gender affirming care under Medi-Cal, and it completely improved my overall well-being. Before receiving care, gender dysphoria was a severe barrier. Getting access to medical gender affirming care not only alleviated the weight of dysphoria, but vastly improved my mental health and self-esteem. These benefits extended to improved stability and motivation. Access to this medically necessary care saved my life. It allowed me to pursue my professional and personal goals and become a more productive member of my community. However, this has not been the case for all people, and right now, many TGI people struggle to secure continuity of care amidst federal developments. At the Trans-Latina Coalition, we have witnessed members of our community losing access to gender-affirming care and have faced significant personal distress and institutional barriers, particularly in rural areas. As such, it is imperative that California is clear in its legislation that comprehensive health programs continue to be protected and accessible to all patient populations. Thank you, and we respectfully request your aye vote.
Greetings, state senators. My name is Dr. Malachi Cote. I use he, they, and fam pronouns, and I'm the executive director of the Gender Health Center, and I'm a licensed psychologist here in Sacramento. And I'm here in strong support of AB 1876. At the Gender Health Center, we provide low-barrier services to all community. This includes a free hosted gender-affirming hormone prescription clinic and a hosted electrolysis services, HIV, STI testing and linkage to care, mental health counseling, support groups and cultural programs, harm reduction services, legal assistance, healthcare navigation, case management, resource referrals, and education and training. Our services are open to everyone, and we center on serving BIPOC, Two-Spirit, transgender, gender diverse, and intersex communities. At the GHC, we have witnessed people coming into their own lives, becoming fully who they are, and experiencing what some call gender euphoria. We have seen the profound impact of gender congruence and joy associated with access to gender-affirming care, and health more generally, as an entryway to fully living. But I'll tell you what, in the past year and a half, many families have come to the GHC experiencing fear of the potential loss of medically necessary care for their youth or teen, or they have lost access and are looking to find care elsewhere. And it's been an extremely stressful time for families, as parents and caregivers are typically only looking to support the growth, development, and thriving of their child. So it is for these reasons that we support AB 1876, which would strengthen protections against discriminatory health care coverage plans. It would ensure service coverage for all patient populations, and as such would also preserve the autonomy of a person and their support systems to make medical decisions in collaboration with their medical provider and be self-determined when it comes to their own health care. So it is for these reasons we respectfully ask for your aye vote. Thank you.
Thank you. If there's anyone else in the audience that would like to register their support, please come to the microphone, state your name, your organization, and your position.
Catherine Squire on behalf of the California Commission on the Status of Women and Girls in Support.
Good afternoon, Tyler Rindy, California Psychological Association in support. Thank you.
Clifton Wilson on behalf of the California State Association of Psychiatrists, as well as the City and County of San Francisco, both in support. Thank you.
George Hughes on behalf of the California Behavioral Health Association in support.
Katie Van Dynes with Health Access California in support. Thank you.
Omar Altamimi here with the California Pan-Ethnic Health Network, Disability Rights California, and Western Center on Law and Poverty, all in support.
Emily Patterson on behalf of Planned Parenthood affiliates in California as a proud co-sponsor in support, and on behalf of the ACLU in support.
Cesar Gonzalez Garcia with the California Rural Indian Health Board in support.
Hello, Kelly McMillan on behalf of the California Associations of Marriage and Family Therapists and the American Academy of Pediatrics, California. Thank you.
Tim Madden, representing the California chapter for the American College of Emergency Physicians in support.
Hi, Kathy Van Austin on behalf of the American Association of University Women of California in support.
Thank you. Seeing no further individuals wishing to speak in support, if there anyone in the audience that would like to speak and lead opposition to this bill, this is your time to come forward to the table. Thank you. You will both have a total of 5 minutes for your presentation.
Thank you.
My name is Luke Healy. I'm a California detransitioner. I identified as a transgender woman from the ages of 11 to 22, and I took estrogen for much of that time. I'm here because this bill would have helped further guarantee my destruction and deterioration. I was groomed online into this starting at age 10. Older men and women online, as both as activists, told me that I was really a girl. They sent me pornographic images, videos, coached me to dress as a girl because they said I was really a girl, and what followed was years of depression, self-harm, drugs, and alcohol abuse. No mental health provider tried to unravel why I believed I was a woman. I said that I was trans, and that was all it took. The medical providers even counseled me to tell my parents that I would kill myself to coerce them to consent to hormones. I left home at age 18 and at one point lived on what I can only describe as a transgender commune where insurance covered my hormones. I got them through Planned Parenthood and Kaiser Permanente. Kaiser doctors pressured me to get sex-rejecting surgeries, and other doctors coached me how to get the state of California to pay for facial feminization surgery through the University of California system. I could get breasts and damage my reproduction or get my reproductive organs destroyed at little to no cost. The medical complex and insurance were set up to destroy my body, steal my fertility and my manhood. AB 1876 will enshrine this system of perversion into law. Insurers will be prohibited from maintaining any categorical exclusion for sex-rejecting interventions. It does not matter if the patient is actively addicted to substances, had unresolved sexual trauma, or other mental health issues. Under this bill, denying body-destroying interventions to anyone, even someone in my condition, will be illegal discrimination. Please vote no. Thank you.
Erin Friday, attorney, president of Our Duty, a national organization of parents whose children have been harmed by the gender industry. We oppose. California law already requires that insurers cover medically necessary sex-rejecting treatments. Setting aside the false premise that sterilization or the use of hormones is medically necessary to affirm a fictitious internal sense of self, this law removes the clinical safety valves. Prior authorization, medically necessary reviews, evidence-based clinical criteria from insurers. It mandates coverage by anyone who requests it, anyone, irrespective of age or mental capacity, for all types of requested sex-rejecting interventions. The governor vetoed SB 418 last year that tried the same, mandating sex-rejecting interventions because it would suppress utilization management by insurers. This bill prevents an insurer from maintaining a categorical exclusion for the removal of a 12-year-old girl's ovaries in the if she's seeking to affirm her gender identity. An insurer cannot exclude from coverage the removal of 11-year-old's testicles because at that moment in time, he thinks he is a girl. Insurance carriers who want to follow the AMA or the Society of Plastic Surgeons positions withdrawing support for sex-rejecting surgeries on minors because, I quote, there is insufficient evidence demonstrating a favorable risk-benefit ratio for the pathway of gender-related endocrine and surgical interventions in children and adolescents cannot, because this law will make it criminal. A carrier that recognizes the impending tsunami of detransitioner lawsuits and the harms of sex-rejecting interventions can only approve these devastating interventions. You ignore detransitioners, parents, the systematic reviews, the studies, what other countries are doing. What will it take you to stop hurting kids, autistic people, and mentally unwell people, and lesbian and gays? Trans is repackaged eugenics. Vote no.
Thank you. Is there anyone else in the audience that would like to register their opposition? Please come to the microphone, state your name, your organization, and your position.
Nicole Young, parent, and a member of the SFV Alliance in strong opposition.
Meg Madden, on behalf of CAUSE, Californians United for Sex-Based Evidence in Policy and Law, on behalf of Democrats for an informed approach to gender, and on behalf of Women Are Real, in strong opposition to AB 1876.
Leandra Wells with the California Family Council. We're in opposition. Thank you.
Thank you. I will now, seeing no further comments from the audience, I will now bring it back to my colleagues to see if anyone has any questions or comments. The bill has been moved by Senator Menjivar. I do have a question for opposition. You've made some pretty strong statements today. How exactly does this bill change the requirement for coverage in California, since there's already a law in place that requires medically necessary gender-affirming care?
Because this law is actually mandating it, and so an insurance carrier, and you can look at the analysis that is online. What it is doing, it is forcing insurance carriers to cover all gender interventions, irrespective of age, because of the fear of being criminally liable. This bill can assert a $10,000 per incident against an insurance carrier per. It also has a felony component to it. It has a year jail time if an insurance carrier discriminates against someone who says that they are transgender. So an 11-year-old who comes in and says, I want my penis removed, and the insurance carrier says no, they can be taken up criminally under this bill, be fined $10,000, and face a felony if it's looked at as they are being discriminatory against this patient.
Thank you. I will let the author respond to that.
Oh, well, thank you, Madam Chair. Really, this is a very, very simple bill that codifies discrimination protections that are already in federal law in Section 1157 of the Affordable Care Act. So it just takes those anti-discrimination provisions and puts those into state law. Very simple bill.
Okay. So it wouldn't require something that's not already required.
The bill does not expand coverage at all. It simply takes the existing non-discrimination provisions from federal law and puts them into state law, but there's no requirement.
Okay, thank you. And with that, would you like to close?
Well, I just want to say thank you so much to our witnesses and the sponsors and the supporters who came out. I know that every time we do these bills, you have to sit and listen to a lot of hate, and I think it's a prime example of why we do need this bill, is what our witnesses experience every single time we do a bill in this space. So thank you to you for your decorum and your bravery, and thank you to the committee. I trust the committee knows facts from fiction, so I respectfully ask for your aye vote.
Thank you. The bill has been moved by Senator Minjavar. The motion is due pass and we refer to the Committee on Judiciary. Assistant, please call the roll.
Senators Weber Pearson?
Aye.
Weber Pearson, aye. Valadares? Caballero? Caballero, aye. Durazo? Durazo, aye. Gonzalez?